Doctors of Reddit, what is the most obvious lie a patient has ever told about their health history? We got a lot of mandible fractures in the OR and it was always the same basic story of what happened. I was minding my own business and some guy sucker punched me at the bar. I fell off my bed and hit my nightstand. You could tell these people very clearly were in a brawl of some sort. I have a very hard time believing all of them were walking their grandmother to church and a random person punched them. I worked in a hospital for quite a while, though not as doctor. Normally it isn't lying about stuff deliberately. They are often convinced of what they're saying. For instance, a guy explained to me that it was normal for him to have very high blood pressure because he had it all the time. This is not normal. Going down for a smoke then coming up with a Pepsi and eating sheet is not normal. The doc even told him, "You are not going to grow old like that." Nurse practitioner, UTS, plus, for coke. Opiates. Whatever. I have not done any of those. How dare you ask me? Well, they were in your urine. So how did that happen? That mother ducking nurse planted them on me, or someone must have been snorting coke and it came in through the windows and I inhaled it. Both completely true stories. Unreal. Nah man. You're guitar-booking coke and shooting up. We all see your track marks. Last week in an endocrine clinic, discussing an obese diabetic patient's weight gain and diet, I went through each of her meals asking when and what she eats. Essentially, she told me that she drinks a glass of water around noon each day and that's it. Still gaining weight. My attending, I'm a resident, told me I should have recommended that she drink half a glass of water instead. In all seriousness though, some people can't even be honest with themselves. So it's not worth getting upset if they're dishonest with you. Just keep encouraging them in the right direction. My old Swiss doctor used to ask the question how many drinks per day and then double it. I'm guilty of that. I try not to lie to my doctor. But binge drinking for women starts at 4 drinks. 4 drinks. I honestly don't believe I have an issue with alcohol. I rarely have more than 1 drink in an evening during the week. I don't drink every day. I never black out. I don't need it to have fun. etc. But I can drink 4 beers over the course of an evening and not even feel it. Not a doctor. But I've had a few doctors raise eyebrows, and when I was a university student lying about how much I drank a week. Also, I imagine the any consumption of recreational drugs question got a lot of false negatives. Standard, not a DR. But back in my drinking alcoholic days, I was trying to convince multiple hospital staff, post blood work, that I hadn't had any alcohol. My back was 0.50 and I shouldn't have even been breathing. I once had an alcoholic patient with a back of 0.72. It was so high that I had to manually calculate it using the measured osmol in the blood because our machines only go up to 0.5. He was happily goose-stepping around the ER. When I worked in a gyn office, a patient had a really nasty vaginal infection and we could see obvious claw marks in her canal. Her story? She had gotten out of the shower, laid on the back on the bed with her legs up, and lifted her cat up above her. She then said she dropped the cat and the paw went into her vag. What? I've had multiple women claim to not have had sex in years while holding their positive pregnancy tests in my hand. I've had this happen so many times. There was a 3-month pregnant lady who claimed it's impossible for her to get pregnant because her husband has been out of the country for the past 7 months. I used to work in X-ray. Sometimes people don't know they're lying. Have you had any metal wear replacement? No, they just fixed the bone. Do the X-ray and it's a massive rod in there. And the patient literally had no idea that was there. Or the sadder cases of elderly people who just don't know. You tell them they've had a hip replacement. And they just don't believe you. I was admitted for pancreatitis once and the doctors and nurses repeatedly asked if I used drugs or was a heavy drinker. No to both. They continually didn't believe me even though I told them to test me. I was in the hospital for over a week without once having any withdrawal symptoms. I know that patients lie. But it's just as frustrating when you're telling the truth and they don't believe you. Even my wife told them several times that I did not drink or use Drugas, but they kept saying it's extremely rare to get pancreatitis if you're not a heavy user. I've been hospitalized 3 times for pancreatitis because 2 other members of my family have had it. They've decided with me that it's genetic and blood sugar related. But the number of times I'm asked how much do you drink instead of do you drink irritates me. Read my damn file. This last time when the intern started on that path, I replied with I'm Muslim and take my faith seriously. I didn't have my hijab on. I was too sick to care at that point. The intern's name was Mohammed. He quit with that line of questioning. Not a doctor, but my cokehead uncle has suffered from sinus infections for years as a result of his use. He lies about the cause of his infection, saying it's allergies, a cold, or the flu to garner pity from others. He's on disability and Medicaid, so he can easily get in to see a doctor each time he gets sick. He's been on so many antibiotics he can only use the super strong stuff to combat the infections now. He takes pseudoephedrine every day to clear his nose as a result of his allergies. He uses so much pseudoephedrine he has to ask friends to buy it for him because he uses more than his state's monthly limit. He had surgery to open up his nasal passages a few years ago. He felt great for a few months before he went back to having the same issues. Are you sexually active? Turns and looks at mother. Lol. That happened to me as a teenager. You better believe I lied. Been a patient accused of lying. Was a fresh young first year university student. First time living away from my parents and taking care of my own medical needs. Signed up to a new doctor and got a slew of basic blood work done for a general health checkup. Get a phone call saying all is not well and I need to go in to speak to the doctor. Turns out my liver function is raised. She asks how much I drink. Maybe 1 drink a couple of times a month. Truthfully, she doesn't believe me. The practice was on campus and all her patients were students. She tells me that she knows how much us students drink, but I'm adamant I don't drink that often. She tells me to cut down and sends me on my way without further investigation. Fast forward 3 years and I change doctors again and get the same blood tests. Same result, elevated liver function. A quick check of my notes tells the doctor I'm on medication that can cause this and have been for years. Mystery solved. I continue to have elevated liver function some 11 years later with no noticeable effect. No harm done by not being believed by that first doctor, but it annoys me that she never bothered to check my records for medication and that if it had been something else more serious she didn't check it out or give me more tests to find out what it was. Just presumed I was drinking myself to an early grave. The condom always broke when he had sex with sketchy prostitutes in exotic locations. No. Dude. You don't wrap it at all. And you're too embarrassed to come out and tell the truth. Not so embarrassed you'll stop having unprotected sex with prostitutes in exotic locations though. We both know that. This is totally the wrong place to ask this. But last year I got some pretty bad rhabdo from doing the same workout I had been doing for 6 months. Took me 2 days to go in. Cause I just figured it was a pulled muscle that was making it miserable to walk with no signs of kidney failure. All doctors since give me a look of pure disbelief when I tell them I did nothing different. I can clearly see them checking the liar box in their head. How do you convince a doctor you aren't lying when your story makes no sense? I am not a doctor but do have experience from the patient's side of the story. I've been in the ER a lot. Sometimes like once a month. Because they couldn't find the cause of a returning stomachache. Kept asking the same questions. Pregnant. STD. Appendicitis. etc. They even kept asking if I really didn't feel pain on the other side, because that made more sense. Eventually they just gave me painkillers because the pain would fade after a few hours. After a few months back and forth, one doctor did one last minute test. I had to sit in the general hall. Waiting. Because the ER was overcrowded. Turned out I had several abscesses on my uterus and had to be treated for several months. Even then the nurses didn't believe me when I said I was in severe pain. making comments like it doesn't look like you are in pain. But when they saw my blood pressure and heart rate, they took me a bit more serious. Still skeptic, but at least they didn't make comments anymore. I still can feel really bitter about that period in the hospital. Not a doc, but I read medical records for work. One woman went to the ER for a cold sore on her mouth which they determined was due to herpes. She then insisted that she got it from the chicken nuggets that she just ate prior to coming to the ER. Not a doctor, but used to work in an ER. High proportion of patients who are allergic to NSAIDs. When you tell them you'll give them Tylenol instead, oh I'm allergic to that too. I'm actually the opposite. Allergic to narcotics. So at most I ask for ibuprofen. I broke my ankle a few months ago. ER nurse asks if I want anything. I tell her no. Allergic and all that. She proceeds to ask 2 more times just in case. Like lady. WTF. No, I prefer not to die just to avoid some pain. It's weird how many people don't believe someone can actually be allergic to narcotics. Not a doctor, but I had a year-wide drug test at my school. And I collected my results at the same time as one of my friends, next to each other on the register, and the nurse asked him to explain a few of the findings in his test. Nurse, please could you explain the marijuana traces found in your urine? Friend, a second-hand smoke. I'd never touch that stuff. Nurse, okay then please explaining the DMT. MA. And ketamine. Friend Dart. Nurse Dart. Nurse, the headmaster will see you in his office at 12:50. Not a doctor, but EMT. I love the ones who get revived by Narcan and claim to have only had a couple of beers. Narcan doesn't work that way. Well, I accidentally outed myself as a nose picker to my ear nose throat doctor. He was examining the inside of my nose and said, "Do you blow your nose a lot?" I was like, "Nope." And he stood up straight and just looked at me, nodding, and said, "Huh." I realized after that I probably have a lot of scars on the inside of my nose from picking it. I played myself. Had a PT on scene one time, claimed he hasn't done meth in several years and was sober since. Then PD opened the door to the rig and said they found his meth and pipe and he was going to jail when his seizures stopped. Not a doctor, but mom's a nurse. Asking older women if they've ever had elective surgery. They say no, as they're obviously perky and round bobs sit pleasantly high up on their chest. Sure you haven't, ma'am? I forget about mine because it's been so long. And I'm only sort of older, 46, and mine are only 10 years old now. Sometimes when asked about previous surgeries I say no. Then remember I've had my tubes tied. Often I still forget the bob job. Might not be intentional lying. We just get past the recovery and move on is all. I'm not a doctor, but I know many women patients lie about how they fell off the floor when clearly there are bruises and injuries from domestic violence. An aunt of mine had a black circle around her eye cause of domestic violence. I was young and I primitively asked her about that when she came asking for glasses before heading out, to which she answered, "A bee stung. Seen a lot of shit." I'm not a doctor, but I was in a mental hospital because I tried to heal myself while on acid and I caught a cold. I tried asking for some cold medicine, but the doctors pretty much thought I was lying about my health to get Drew Gus. I don't blame them. One of the patients there was snorting his pills, so I get it. It took the 2 days to figure out I was actually sick. Not a doctor, but I've been drunk at a hospital waiting for a friend with alcohol poisoning. Took a selfie to send to the rest of the group and realized in the morning, more like afternoon, how drunk I was looking, beside vomit stains on the trainers. Mismatched clothes and sunglasses at night. I don't think anyone believed me when I insisted that I was sober. Got a few weird looks from the doctors and nurses. Thank God they didn't insisted.